Hello and welcome to this segment of IPPFA TV. I'm James McNamee, president of the Illinois Public Pension Fund Association, and with me from my board is Gene Washington, a retired firefighter from Maywood, and Dan Collins, a firefighter from Skokie Fire Department and also a board member. Today, we're going to be interviewing our guest, Joanna Doran. And Joanna is the CEO of Triage Cancer. It's a national not-for-profit organization providing free education on practical and legal issues that may impact individuals coping with cancer. Ms. Doran has spent many years, over 30 years, on behalf of individuals as an advocate for cancer. She's also worked as an adjunct professor at the Loyola Law School and has taught at the John Wayne Cancer Institute Psychosocial Care Program. Do I have that right?
Yes.
I do. Okay. Sometimes I stumble over myself. And, she's co-authored a book, Cancer Rights for Law for the American Bar Association. And I believe it was the first of its kind type of book to be putting out there. So our hats off to you. So you have a very, what I like to say, outstanding resume dealing with this issue of cancer. And I'm going to open it up with the first question, which is, what made you focus on this? I mean, what got you into this area of focusing on cancer research and laws and assistance to cancer patients?
That is a good question and maybe a bit of a long story. But first, I would say that I'm honored to be with you. When I was in law school, I also worked at the John Wayne Cancer Institute for that psychosocial care program. And one of the many things that I did was actually fit patients for mastectomy bras and prostheses after breast cancer surgery. And then I would have to go bill insurance for those items. And I would bill insurance and they would deny coverage. And so then I'd have to call up and say, why was this denied? This should be covered. It's a covered item. And they would say, denied, denied, denied. And I happened to know about a law that I learned about in law school called the Women's Health and Cancer Rights Act, which actually required coverage of those items. And so I would say to the person on the phone from the insurance company, what about WICRA? And they would say approved. And so it just demonstrated to me that the very little bit of knowledge that I had about that particular issue totally changed the outcome. And people shouldn't have to go to law school to be able to navigate the healthcare system. But so many of our systems are set up so that if you don't know what your rights are and you don't understand them, then these systems are going to walk all over you. And so it really showed me that I could use my legal education to actually teach people about laws and programs that exist to help people navigate accessing healthcare. And in the context of the cancer community, it is often time sensitive and life-threatening. And so the importance of understanding your rights and your options and being able to effectively access the care that you need is so important that being able to teach people is incredibly rewarding work. And it's ultimately why I'm still doing this work 30 years later.
Well, I have to say I'm very impressed with your website. I've gone through it. It's a lot of resources there. And I know that dealing with people who've had cancer, how overwhelming it is and how many things you have to go through. And I've seen it with friends and elsewhere. And it's nice to know that there's an organization out there like yours that can assist them through some of these things. And, and we've now seen in your organization, you actually have a whole separate section for firefighters right now, right?
We are trying to build out those resources because we do understand the prevalence of cancer for members of the fire service.
Yeah, and we think that's very important. Obviously, we have a significant amount of our membership within Illinois Public Pension Fund Association are firemen, and they are exposed to a lot of chemicals, a lot of different types of things that can cause cancer, and as seen by their occupation and the rates of cancer amongst their occupation and stuff. So it is a deep concern. But the other part that I really was fascinated with, and maybe my two other board members like to jump in on this, was the issue where you get denials, and you're trying, and most people, a lot of people just give up. They get denied. they don't know what to do. And it's how, how do you deal with that? And how did you, when you did this, you saw that as a big problem, right? You came into this and you said, this is a right that's got to be fixed because the denials are a big problem.
Yes, and certainly the example that I gave was my first introduction, but the systems have only gotten worse. And so now we even see health insurance companies using AI to be able to review claims even faster and not really taking into consideration all of the medical information that justifies why somebody needs access to care. So appeals is a bit of a soapbox issue for me because people need access to care, right? Their healthcare team has prescribed care for a reason. And when insurance companies deny coverage for that care, it makes it that much harder to be navigating not only accessing that care, but dealing with the medical condition to begin with. And really, when people are sick and feeling side effects from treatment, they shouldn't also be having to fight their insurance company. And so you said people give up, but people often don't even try. So there's data that shows that 99.9% of denials are not appealed. That means
Wow.
0.1% of people are appealing, which is a crazy statistic. But if you have private insurance, like through an employer or an individual plan, you actually have the right to go to an external appeal, which means you get to go outside the insurance company to an independent entity, and they decide whether or not that care is medically necessary. And those external appeals are successful on average 50% of the time, which means about 50% of the time, the insurance company is getting it wrong. But people aren't even questioning the denial. They're taking no for an answer. And that means two things. It means patients aren't getting access to the care their healthcare team prescribed, or they're paying for it out of pocket, which contributes to the financial hardship that we see when we're dealing with chronic and serious medical conditions like cancer.
Yeah, I know.
Joanna, when you say, oh, I'm sorry.
Oh, go ahead, Gene. I'm sorry.
When you say an outside appeals process, is that a state agency, a county agency? How does that work?
That's a great question. So it depends on the type of insurance that you have and the state that you live in. So it could be that you're going to the state department of insurance, like in Illinois, you can file an independent or external medical review with the state. And the state is actually going to hire an outside entity to review your medical records and your appeal and decide whether or not it's medically necessary for you to get that care. There are other situations where if you have a self-insured employer plan, which many members of the fire service and police officers actually work for municipalities where they are self-insured, then it is the employer that actually hires the independent medical review organization, which then there's some question about whether or not it's really all that independent.
Yeah.
But the process does work because we know that claims are being overturned.
Thank you.
Yeah. No, I went through that myself. So me and my wife had to file an appeal on something, and we had to argue with the self-insured plan. So had to argue with them
Yeah.
about it.
And it's hard because, again, it's just one of those other very complicated systems that we have where you file the internal appeal to the insurance company, and then you can file the external appeal. But if we're talking about denials before care, like when you have to go and get a prior authorization from your insurance company before you get the care, if it's urgent that you get access to the care, you can file the internal and the external appeal at the same time and get a response back within 72 hours. But who knows that? Like the average person doesn't know any of this information. So you wouldn't necessarily think to approach it that way. And so unfortunately, people submit the internal appeal and then wait, and they don't hear from the insurance company, and things just get delayed and delayed and delayed. And then people give up. And unfortunately, it's the system's sort of set up to do it that way.
No, I can't imagine if you're a cancer patient and you're dealing with all the emotional and stress and everything else, and then it's hard enough just to navigate all of that, and then to have a denial, and I can't imagine most people aren't a little depressed. So they don't. A lot of times they just don't have the fight in them, I would think, in some cases, and that's a bit of a problem. So would you suggest that they always have an advocate, somebody in the family that's willing to be that fighter for them if they don't seem to have the ability to do it?
It's always helpful to have friends and family who can help with the process. And we have lots of tools to explain step by step what the process is for you based on the type of plan that you have. But family and friends are always a great resource to help, even just to be on the phone when you're on the phone with the insurance company and taking notes, or having to deal with some of the bureaucracy and the paperwork. But not everybody has, a support system like that. And so there are others in the community that can help provide that support. And at Triage, we're definitely here to be a resource to understand what the process is so that you can kind of most efficiently and smoothly get through the system.
Well, that's awesome,
Joanna?
and like I said, your website is quite a resource. It's Triage Cancer. I mean, it's a to me, I look through it and I'm looking at it right now, and I'm just amazed at all the tools you have there for us to do. And of course, you do training. Your organization does educational training for people. Now, it isn't just for cancer patients, but it's also for caregivers and others, right?
Exactly. So we really want to make sure that everybody has access to this information. So we have programs for patients and caregivers, because caregivers have rights too, in terms of being able to take time off work as a caregiver and how to replace lost wages. So there's resources for caregivers. And then we also train healthcare teams and advocates so that they're better at helping the patients that they're serving. So they have a better understanding of these issues and know how to point people in the right direction. But we also rolled out a program called Triage Health, because every single day people call us after they're already in a crisis situation. And we want to try to prevent some of those crises. And so how can we put this information in the hands of people earlier? But the challenge is lots of people don't like to talk about cancer. And so the second that they read something that says cancer on it, they sort of dismiss it and say, that's not for me. And so we wanted to make a lot of this information available through the Triage Health program so that anyone would feel comfortable using the information. And we joke a lot in the office that all of what we're teaching people are things we should have been taught in high school. So understanding how to pick a health insurance plan, understanding our employment rates, making sure you have a will. Everybody over the age of 18 should have estate planning documents in place. It's just that no one likes to think about those things and no one likes to deal with them. And it's all things, related to adulting that you don't really want to have to deal with until you're in a position to actually need to. But at that moment, it's a lot harder. It's a lot harder to navigate all of that information when you're also dealing with a serious medical condition. So we do have a lot of this information available through our Triage Health program as well.
Now, all of that assistance is free, correct?
It is. Everything that we do, our educational events, all of the programs and resources are free. And then we also have a free legal and financial navigation program where anyone can contact us with their questions, and we will talk to them about the laws that apply to their situation, the programs they're eligible for, and help them understand what their next steps are.
And this is a real person we're talking to, not AI.
It is a real person. It is not an AI tool.
I bring that up because you call a bank and you're talking to a recording half the time. You don't know what you're talking to. So, and that's important because when you're dealing with this, like I said, to me, my experiences, especially when you're dealing with health situations, is I want to talk to somebody.
Yes. And we appreciate that. So we do have all that information on our website. We have even the events that we host, we record them so you can watch them at any time. We do have some AI tools to help people get answers to their questions quickly. But then if you still need information and want to talk about your individual situation, that's why we have that navigation program.
And you have, so a lot of your materials are downloadable, right? So
Yeah.
if I went on there, let's say we have our members, they go on there, they can download pamphlets, they can download, check off the boxes, resource information, other things, correct?
Yes. And we also, if departments or community organizations or hospitals actually want to order our materials in bulk, we will ship them for free as well.
That's
And
excellent.
Joanna, oh, sorry, Jim. Joanna,
go ahead. This is Dan Collins.
Yeah, I just wanted to ask. Well, I'll put it out there too for full disclosure that Joanna's husband and I worked together at Skokie. I was glad to see that your group was brought in independently to the IPPFA because we've talked about it before. It's a great resource, but along the lines of having a point of contact, say with a department or municipality, since we've had these issues with work comp where potentially it's going to be a work comp case. The insurance company starts asking, is this work related? Is someone else responsible, for payment, potentially a second insurance plan? And with it being self-insured, a lot of times with municipalities, you can get caught up, or get caught in between. So that can become a real problem. And just anecdotally speaking, I've seen that before because I've advocated for people outside of my department as well, just volunteered to help others, like in my Mavis division that called us up. And this is just what I've seen over 25 years on the pension board. So then who would you think would be the good contact person, say, with a department? The union doesn't sometimes capture all members. The municipality, as we know, has that outside arbitration process that may or may not be as straightforward as it should be. And the pension board, though, would encompass everyone. So would that be something you would suggest, is to bring this through a pension board president and then disseminate the information from there?
I
Or
think that is a
be
good
your best,
idea.
be your best suggestion, you think, so we can get everybody the resources?
I think that that is a good resource for us. The more people who have knowledge, the better. So anyone who is in a position with a department who can share information is a valuable resource. I do think that your point about workers' comp, it's an entirely separate area of law, which frankly, we don't spend a lot of time dealing with at Triage because it's very hard to show that cancer is actually due to an occupational exposure. And that's the value of those presumptive eligibility laws, is because it removes that challenge for members of the fire service who it applies to. And so workers' comp is tough because it's about causation and it's about percentage of disability. It's a very nuanced area of law. And then you layer that into uh, union bargaining agreements on top of that, and then municipalities. And so it becomes very complicated. And often it's the individuals who get caught in the center of that, just trying to get access to care. And so making sure that people have resources to get answers to their questions within departments is very valuable. So I appreciate that you are looking for ways to be able to provide that information.
That's kind of, this is Gene here. That's kind of specific. Your organization doesn't only work with firefighters, but police officers and regular employees also. So I'm thinking, to piggyback on Collins's comment, would you think an HR director for an entire municipality or village would be, you would touch more than just firefighters or police officers? That way you get like public works and office employees and
Yeah.
things of that nature. Or do
I
you
will
work? I'm sorry, go ahead.
I'm so sorry to interrupt. I was just going to say that the educational events that we host provide continuing education for lots of different types of professionals, including HR professionals. So they can actually come to our events and get free continuing education on topics that could be impacting their communities. And I will also say it's not just the employees, it's also family members. So we often see individuals who are members of the fire service or police officers, where it's their family members who are diagnosed with cancer or another type of serious medical condition and are trying to navigate their benefits and to make sure that their families are getting access to care. And that's even true if somebody is pregnant and has a child, and the medical bills and the medical care associated with that can sometimes be a challenge in making sure you understand what your benefits are. So it's sort of a universal challenge, but it becomes even more important when somebody is diagnosed with a serious medical condition like cancer.
Well, again,
Thank
this
you.
is excellent information. And IPPFA, Illinois Public Pension Fund Association, looks forward to working with Triage Cancer and getting you out to some of our conferences to speak to our membership, which is the pension boards and municipal officials and the like. And we think that the information is important. We love to have an organization such as yours piggybacking with us to help and assist our participants and retirees that are out there. I can't tell you enough about how I've had to deal with this, with, on a personal level with friends and so on. And, having resources is important, and having advocates is important. And you're under so much stress when you're ill, and your pocketbook is under so much stress when you're ill, because, as everybody knows, you're not working overtime then. You're cutting back, you're sucking all this time off, you're worried about so many things, and it adds so much extra pressure on you. And if there's an organization out there like yours that can step in, assist, give them direction, that's awesome. And my hat's off to you. I think it's an incredible thing that you're doing. So we're at our time limit coming up. So we're going to end this. But if you don't mind doing a little commercial about Triage Cancer, resources and how to get a hold of you, your website address, all those things at the end here, we'd really appreciate that.
Well, anybody can visit triagecancer.org or triagehealth.org, and you can find all of our educational events that you can register for free, all of our programs and resources. And then if you want to talk to our navigation program, you can go to triagecancer.org/get help.
Thank you. And your book, again, what was it called again? The book that you co-authored?
Cancer Rights Law.
And that's more for attorneys, correct?
It is for everybody, but it is a dense read. But if you are looking to understand the various areas of law that come up in the context of a cancer diagnosis, it's a useful tool to better navigate systems.
And that book is available on Amazon?
It is, and also through the American Bar Association.
Thank you so much. And again, to our IPPFA listeners out there, this is James McNamee, Gene Washington, Dan Collins, and Joanna Doran for IPPFA TV. And this closes out our segment.